Namaste. Welcome you all for the yoga session. In this session, we are going to practice one of the standing postures, the Parsvottanasana, in conjunction with some basic movements that involve the lumbopelvic hip complex. To begin with, we shall do some preliminary warming up postures. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Feel also the posterior region of the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As we exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Rise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Stretch the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring. So feel the stretch. Relax the left leg. Right leg up. Fold. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As we inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. Very important to have complete postural awareness. Do not allow the pelvis to rotate. Release left leg. One more time. Right leg up. Fold. From left hand, hold the ankle joint. Pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis. Because this is the region which takes a lot of loading. And these postures prepare one to safely practice other postures. Release right leg. Change. Left leg. Fold from right hand, hold the ankle joint. Pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket. Also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold. From left hand, hold the ankle joint. Pull it. From right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull. From left hand, push the knee across the chest. Press it closer to the trunk. So here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold, from right hand hold the ankle joint, pull, from left hand push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain. Left leg up. Fold, hold the knee, press the knee closer to the chest. But completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot, keep the heel in contact and gently slide, straightening the right leg. Right heel also have to straighten, toes towards the knee, pull the kneecap, charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain. Left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Just be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain. Left leg up, fold. Keep the ankle slightly below the knee. Rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg, left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand to push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain. Left leg up, fold, ankle just below the knee, rise your right leg with knee flexed. From right hand, pull the right thigh, from left hand push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement Knee and ankle also become active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where a thick skin, the thoracolumbar fascia, is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yoga asana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Kneel down. Take your right leg forward. Knee bent at 90 degrees. Both hands on the waistline. As you exhale, flex the knee completely. Completely flex the right knee, chest and navel up. This is a good stretch for the hip flexors. Keep the left leg also active. Stretch the left foot, squeeze the calf muscle, tighten the buttocks, chest and navel up. Feel your lower back. Press the right foot firmly. Breathe well. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Slowly come up. Right leg back. Chain. Left leg forward, knee at 90 degrees, both hands on the waistline. Inhale, exhale. Flex the left knee completely.
Keep the left foot pressed. Left hip is in flexion, right hip is in extension. Left knee is completely flexed. Right knee is nearly neutral. Left foot is in dorsiflexion while right foot is in plantar flexion. Watch all major joints, major muscles, feel your base of the spinal column, chest and navel up. This posture is good for the hips and the lower back. Slowly come up, take your left leg back, sit on your heel in Vajradasana, chest and navel up. Kneel down, right leg forward, right knee bent at 90 degrees. Bend forward, keep the fingertips on the floor by the side of the right foot. Left leg straight, turn the left foot inward. Keep the right leg slightly bent. Left leg absolutely straight. Press the outer edge of the left foot. Stretch the trunk. Then slowly straighten the right leg. Both legs straight. Right heel and left heel as though they are one by the side of the other. Both legs straight. Breathe well. Push the root of the right thigh down. So this posture helps the trunk, hip and the legs. Flex the knee, rest the left knee, take the right leg back. Then chain. Take the left foot forward. Fingertips by the side of the heel. Stretch the spine, press the fingertips, right leg straight, press the right foot, turn the right foot in, press the outer edge of the right foot. For that you have to roll the right thigh out. Left knee slightly bent to begin with, then slowly straighten the left leg. Both legs straight. Keep on pulling the kneecap. Even pressure on the left ankle joint. Even pressure on the inner and the outer ankle. Watch your breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Flex your right knee. Then take the left leg back, sit on your heel, sit upright. These forward bendings will help the hip and also the lower back. Stand up. We are going to induce a proper forward bending posture. Stand upright, foot 6 inches apart, inner edges of the foot parallel. Flex the knee. Hold the big toes from both hands. Ensure that the abdominal cavity sits on the thigh. Stretch the spine. Hold the big toes. Then slowly straighten the knee. Stretch the spine. Try to maintain the integrity of the spinal column. That is, do not flex the trunk. The forward bending of the trunk should be from the hip. This is more a hip flexion. For that you have to activate the gluteal or the hip muscles and especially the back of the thigh, the hamstring muscles. Pull the kneecap, roll the thighs in, straighten the arms. You have to stretch the trunk diagonally downwards. Now slowly flex the knee, come down, sit on your heel. So in these standing forward bends, learn to engage the gluteal and the hamstring muscles more predominantly. Watch your breathing. Stay connected with the posture. Kneel down. Take your right leg forward 90 degrees, bend forward, keep the right hand fingertips by the side of the heel and slowly straighten the left leg, press the outer edge of the left foot, left heel as though to the side of the right heel, then slowly straighten the right leg. You can flex the arms a bit and try to bend forward. Both legs straight. Press the outer edge of the right foot. Also watch the inner edge. Keep the right foot evenly pressed. And press the outer edge of the left foot. Flex the knee, come down. Take your right leg back. Chain. Left foot forward, left foot between the two palms. Keep the fingertips pressed. Stretch the spinal column. Raise your right leg up, right leg straight. Press the outer edge of the right foot. Turn the right foot as much in as possible. Keep the left knee slightly bent. Stretch the spine and then slowly straighten the left leg. Also flex the arms so that trunk can bend little more downward. Be strong on both the legs. Keep on pulling the kneecap. Do not hold the breath. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Push the root of the left thigh down. Activate the hip and the back of the thigh. Flex the knees, slowly come down, take your left leg back, sit on your heel. So these standing postures would greatly benefit the complete trunk, especially the lower back. They also help to rejuvenate the gluteal and the thigh muscles. Fold the blanket. Sit on the blanket in cross-legged posture, Swastikasana. Hips on the blanket, foot on the floor, so that you can keep the trunk upright. Inhale, exhale, turn to your right side, left hand on right knee, right hand fingertips on the floor. Turn the trunk. Turn the neck also in the direction of the twist. Stretch the trunk, twist the trunk. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. When doing these kind of forward bends, sometimes there will be a stress, especially in the beginning phases of practice, on the lower back. These twists would help to remove any such imbalances in the lower back. Slowly come up. Chain. Inhale, exhale, turn. Right hand on left knee, left hand fingertips on the floor, turn. With every inhalation, try to stretch the trunk up. With every exhalation, try to twist more. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Feel the complete lower back, the upper back, and also the neck. Slowly come up. In all the forward bends, it is important to engage the gluteal and the hamstrings. Towards that, we have to focus. Stand upright. Join the heel, join the big toe. Both hands on the waistline. Chest and navel up. Jump 4 to 4.5 foot apart. Right foot 90 degrees out. Turn the left foot as much in as possible. Press the outer edge of the left foot. Ensure that the heels are one by the side of the other. Inhale, exhale. Turn the trunk circumferentially towards and in line with the right leg. Chest and navel up. As you exhale, slowly bend the trunk forward. Keep both the palms rested on the floor by the side of the right foot. Stretch the spine. Push the root of the right thigh. Both legs straight. Parsvottanasana. Even pressure on the right ankle joint. Slowly come up. Both hands on the waistline. Turn to the center. Change foot. Right foot in. Left foot 90 degrees out. So if you draw a line from the left foot, the right heel should be on the other side of the line, opposite side. Right leg also straight. Inhale, exhale, turn the trunk. Both legs straight. Stretch the spine. Inhale, exhale. Bend the trunk forward. This bending should be predominantly from the hip. It should be a hip flexion. Keep both the palm by the side of the foot. Stretch the trunk. Breathe well. Push the root of the left thigh down. Turn the right thigh outward, pressing the outer edge of the right foot. Be strong on both the legs. So this is a very good posture for the muscles of the hips, legs, and also the pelvis. Slowly come up, both hands on the waistline, turn to the center, foot parallel. Jump feet together, Tadasana. Sit on your heel, sit upright. Proper forward bending is very essential for the health of the lower back. So in the forward bending of the trunk, we should learn to recruit the gluteals and the hamstrings, that the muscles of the hip and the back of the thigh. Then forward bendings will be safe, and also they help the back muscles. Sit in Kakasana, press the foot and flex the knee, stretch the spine, hold the ankle joint, straighten the knee a bit. Now ensure that the abdominal cavity is in flush with the top of the thigh, foot 6 inches apart, inner edges parallel. Now gripping the ankle joint, slowly straighten the knee, but ensure that the abdominal cavity still is glued to the thigh. Stretch the spine, relax the neck. Uttanasana. Roll the thighs in, be strong on both the legs. Feel the hamstrings, back of the thigh and the gluteal muscles. Uttanasana is an excellent posture for the complete trunk and the legs. It's good for major muscles in the trunk. Flexing the knee, slowly come down, sit on your heel. Slowly get up. Stand in Tadasana, join the heel, join the big toe, pull the kneecap, roll the thigh inward, both hands on the waistline. Jump 4 to 4.5 feet apart. Right foot 90 degrees out, left foot inside. Heel as though one by the side of the other. Turn the left foot in, inhale, exhale. Turn the trunk circumferentially 90 degrees. Inhale, exhale, bend forward. Rest both the palm by the side of the right foot. Turn the left foot as much in as possible. Both legs straight. Stretch the trunk. Take the abdominal region closer to the thigh. Push the root of the right thigh down. You can flex the arms to allow the trunk to come down more. Slowly come up, take both hands on the waistline, chain. Foot parallel, left foot 90 degrees out, right foot in, turn the right foot, right leg straight. Circumferentially turn the trunk towards the left leg. As you exhale, slowly bend the trunk, rest the palm by the side of the foot. Flex the arms and stretch the spine further. Keep on pulling the kneecaps. Push the root of the left thigh down. Charge the outer edge of the right foot. Do not hold the breath. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Slowly come up, both hands on the waistline. Turn to the center, foot parallel. Jump Tadasana. Sit upright in Swastikasana. Clasp the fingers. Inhale, exhale, stretch both arms up, opening the face of the palm up. There's a good stretch for the arms, a nice flexion. Palm should move up and slightly back. Feel the stretch and tighten the muscles of the upper arms. Chest and navel up. Slowly flex the arms. Stand up in Tadasana, join the heel, join the big toe. Inhale, exhale, jump 4 to 4.5 feet apart. Stretch the arms also sideways, both arms in the same line. Turn the face of the palm up, stretch both arms up. Keep on stretching the arms. Right foot 90 degrees out, left foot inside. Both legs straight. From the arms, stretch the trunk further up. Turn the trunk 90 degrees, inhale, exhale, bend forward. Rest both the palm by the side of the foot. Flex the elbows and stretch the trunk. Parsvottanasana, both legs straight. Do not hold the breath. Do not strain the neck. Inhale, come up, stretch both arms up with the trunk, turn the trunk to the center, foot parallel, then chain. Left foot 90 degrees out, right foot inside, heel one by the side of the other. Inhale, exhale, turn the trunk 90 degrees, stretching the arms, inhale, exhale, bend forward. Rest the palm by the side of the left foot, flex the elbows, stretch the trunk further, push the root of the left thigh, both legs straight, stretch the trunk. Breathe well. Slowly come up, arms and trunk up, turn to the center, foot parallel, bring both arms parallel to the ground, turn the face of the palm down, jump Tadasana. So this way we can combine some of the postures with Parsvottanasana to feel the posture better, to go deep into the posture. Sit upright, eyes closed. Namaste.